Good evening, everybody, and welcome to today's session. So, thank you for taking time to come today and listen to the natural hygiene perspective of fevers and other healing crises. So, we have a very informative session planned today for all of you with a quite a well-respected set of speakers. So, I hope you will make the best use of today's session and clarify all your doubts and go forward with a lot of knowledge and confidence. So, let me take a few moments to introduce ourselves. So, I think many of you know us, but for those of you who don't know us, we are a group of people who practice natural hygiene or nature cure, and we all came together to put together this webinar because the kind of environment today, the atmosphere is of fear. There's a lot of fear about fevers and what is going on. There are a lot of questions in people's mind. There is confusion and people want clarity, but many a times we get our doubts clarified from all the wrong sources, and then we end up harming our body, harming our family members, and taking the wrong decisions. So, this webinar is all about enabling you to get the right information, but the decision making will always be in your hands. So, our promise is to help you to make informed decisions, but that again depends on how you take this information, how you implement it, and then what you do with it is, of course, left to you. So let me introduce the speakers today. And my name is Asha Shivaram. I'm going to be the host for today's session. And I'm just going to be coordinating the program today. So today we are going to have Dr. Gauri Rokkam, Prajakta Patil, Dr. Prashanthi Atluri, and Divyansh Gupta, who are going to be presenting. Unfortunately, Swati Dhariwal, who also had to join today, she's not able to join because of some personal commitments. So I'm going to just introduce our speakers today. I hope my voice is audible and you all can hear me. So people are still entering the session. Yes. So our first speaker is Dr. Gauri Rokkam. Dr. Gauri is a gold medalist in food and nutrition. She has completed her masters in whole food plant-based nutrition. She has been practicing as a nutritionist educator for many years, for more than 30 plus years. She's also a diabetic educator and lactation consultant. She has completed her PhD in Yoga and Life Sciences from S. Vyasa University. She is a prolific speaker, she's an author, and she has featured on many TV programs, radio, newspapers, articles she has written, and many conferences. She is also educator and she has presented in many colleges in India. So we are indeed very happy and grateful that we have her in our midst. And then Dr. Prajakta Patil is a young doctor who has just completed her MBBS. She's working as an intern doctor in Pune, and she's very passionate about spreading the knowledge of health and the holistic approach to health, as she herself has seen the benefits. She healed from PCOD by eating fruits, and she's very passionate to spread this knowledge as a young doctor to more and more people. Dr. Prashanthi Atluri is also here amongst us today. Dr. Prashanthi is a cardiologist and she practices in Louisiana in the US, and she has extensive knowledge of both allopathy and nature cure, and her treatment now is primarily to use nature cure principles to help her patients get off medicines and adopt a natural lifestyle. So we are also very grateful that we have her in our midst to for her to share her perspective about this important topic. Then we have Divyansh Gupta. Divyansh is a hotelier by profession, but a nature cure educator by passion. He is very passionate about spreading the knowledge of natural health and living a chemical and drug-free life. He is bringing up his own son without any chemicals and drugs, and bringing up, in a way completely aligned with nature. He is very passionate about spreading the knowledge of health, especially to bring in more and more parents on the plant-based nature cure approach with raw veganism as the foundation. So he's also going to be speaking today, and we are again, very fortunate to have his practical knowledge sharing with all of us today. And we also have two, or I don't know how many more, if they are able to come, a few parents who have kindly agreed to come and speak about how they how they help their children and themselves heal from fevers naturally. So they are going to be also sharing some practical steps with all of us. And last but not the least, we are very grateful to Nandini Gulati for providing us all the logistics and the Zoom account and her complete support for today's session. So, without much ado, let us start. Our first speaker is going to be Dr. Gauri. So, we will first listen to the speakers, and when they complete their presentation, we will take some questions. So, request all of you to have a pen and a book ready and keep your questions ready. So, whenever the speakers are ready, they will be open to taking questions. Thank you, everyone. So, Dr. Gauri, are you able to speak now?
Yes. Thank you, Asha. My respectful pranams to each one of you who have joined us. Let me first share my slides. Can you hear me and see my slides?
Yes, yes.
Okay, so we are all here to understand a little bit about fevers and remove our fears. So I'm going to talk a little about what is fever and what's happening during fevers. We are generally told that a germ, generally a virus or a bacteria, we catch them from the environment or somebody who already has, and they attack us and cause disease inside us. Let's look at a little bit about these microorganisms. Where are these microorganisms? Microorganisms all are around us, on us, and inside us. They are present everywhere, and there is no inch of space on this planet without them. What are they doing? They're called scavengers. They decompose or break down all the waste, toxins, chemicals, dead, and clean up the environment. And that's exactly why they're called scavengers. They're present to clean up, and they're present wherever there is filth. This is very, very important to understand. And so, this theory of a French scientist called Louis Pasteur has been questioned, and a lot of perspectives have been given to his germ theories. Now, coming to nature cure, it clearly states because microorganisms are invited where there is filth, waste, toxins, and chemicals. Why? Because that is their job, that is their food. They're there to clean that up. So, Nature Cure says if we have all that filth or toxins inside us, this is what invites the germs or the microorganisms. And when they are in the process of cleaning up, a lot of toxins are being removed, and that is what we consider as symptoms or the disease or the crisis which is happening inside our body. And this healing crisis creates a lot of symptoms. Let's look at each of the symptom. But before that, let me tell you, we have to remember that it is the toxemia, the accumulation of the toxins inside our body, which has invited the germs or the microorganisms, and all the other symptoms are a healing crisis or the process of cleansing or healing and bringing back the body to balance. And generally, when the toxins are overloaded, a point where body cannot hold it or cannot, contain it anymore and wants to throw it out, is when body increases the temperature to liquefy these toxins so that the cleansing channels of our body can open up and allow these toxins to be eliminated. It could be every possible way the body can eliminate. It could be kidneys, it could be fishes, it could be skin, it could be breath, it could be nose, it could be eyes, it could be mouth. In every possible way, the toxins are eliminated. And let us look at this healing crisis, what body does. So, as I said, body increases the temperature. Why? To liquefy or destroy the toxins and activate the healing mechanisms. And of course, during that time, you will feel very weak and tired. Why? Again, it is nature's process, the intelligence of the body, which is directing the energy, the vitality towards the cleansing process and the repair process. And so it wants us to be in the resting state so that it can carry out all these detoxification. As I said, body is eliminating, so we could be sweating a lot. And the sweat or what is being removed through the skin can be foul smelling and also sticky. And there is increased thirst because body is trying to flush out a lot of toxins and it needs a lot of liquid to throw out these toxins. Body increases the thirst. Then at times when the toxins are huge and body uses the other ways of purging out the toxins from the stomach and the liver, it might even start a vomiting sensation or even get into the loose motions when it wants to throw out the accumulated waste through the colon. And again, as I said, because the body is looking at intensifying this removal process and it wants us not to do anything else, the sleep also seems to be increased and there is a need for resting. Only this rest, physically, mentally, and the physiological rest of not eating is what will help this detoxification. And of course, body increases to increase the temperature to that extent. This we see also chills and shivering because it's an effort of the body while it is raising the temperature. And there could be headaches and the whole body aches, which all of us have experienced. This is also a result of toxin release or even the balancing of things inside the body. So basically, germ theory, which was proposed by Louis Pasteur, will consider or proposes that microbes cause the disease. That is, in turn, we are discussing about the fevers right now. And the symptoms which arise because of the healing crisis are something dangerous and they can damage our body and we are trying to stop them or suppress them. But in the terrain theory, like what Nature Cure advocates and proposes. It is all because of the internal toxins accumulated, which actually invite these germs and microorganisms. And the cleansing process is what creates fevers, or you can, in general, call disease. And this mechanism is actually helping us, cleansing us, and bringing us back to balance and health. So, on his deathbed, this is what the scientist Louis Pasteur admitted. He said, "Yes, I agree. All his life, he advocated and stuck to talking about the presence of germ. Of course, we don't deny the presence of germ. But what we are trying to tell is germ does not cause the disease. Germ does not cause fever. We don't catch a germ unnecessarily. Germs come into the body for the process of cleansing and breaking down the toxins." And he also admitted finally that yes, I was wrong, and it is the terrain, it is the body, it is the place where these filth is accumulated, where the germs come. And with that, I think I'll pass on to the other friends and colleagues who will take it ahead. Back to you, Asha.
Thank you, Dr. Gauri, for this wonderful opening. So, any questions for Dr. Gauri, or should we go with the next speaker? So, I think the summary is that you all heard that the whole premise of fever is based on the false premise of germ theory. And we heard Dr. Gauri's explaining how it's not the germs, it's the terrain of the body, it is the soil of the body, it is what the body is made of which is attracting the germs. So, thank you, Dr. Gauri. I think we will go ahead with the second speaker, Dr. Prashanthi, and then from there on, we can build on to more questions if you all have.
So I think the names have been coming up as your name, Asha. I don't know what happened.
Yeah,
Like
I don't
last
know
time it
what
happened.
happened. Yes, I'm
Yeah.
not sure what happened.
Yeah, that's fine. Sometimes there was a glitch last time also it happened. But hi everyone, how is everyone doing? So yeah, it's a nice, good show of parents, and just let me know how many parents are here. Who is what you guys want to know more about. While Asha is about to project the slides, I just want to recap a bit about what Dr. Gauri has gone over. Right now, we don't really. Now, there are two theories that they have presented. One is germ theory, one of them is a terrain theory. But what theory does make sense more these days for you? Is it the germ theory or is it the terrain? Which one makes sense? Once you understand that, oh, okay, you observe everything in nature is supposed to decompose. And once you understand that the germs are everywhere, right? Everywhere, right here, there are trillions and trillions of germs everywhere. So, how do they decide who is going to attack, what is going to attack, who they are planning on attacking? So, that's when, it's more like a common sense once you understand about how this is all about terrain. So, now terrain makes sense, right? Sonal is saying only terrain is going to make sense at this point. So, let's just where are my slides, Asha? I'm gonna so far so terrain, and then what is the other word Dr. Gauri has used? What are you going to call fevers, colds, diarrhea, eye issues? What do you call that? Conjunctivitis. And then what do you call dysentery, diarrhea, ear issues, all these things? What does Dr. Gauri call them? All of them put together in Nature Cures, what do we call them as? Acute healing crisis. It's time for us to learn new terminologies, new words, because we are all growing up. We are trying to find out more information about what is going around us. So now we are trying to understand what exactly is terrain, what exactly is acute healing crisis. So we're going to put everything: fever, cold, cough, a dengue, a nipah, a COVID, a flu, whatever you guys want to call these as different names, we are going to put them all under one box. And that box is called as acute healing crisis. So, do you know fever is the cure, cold is the cure, cough is the cure, diarrhea is the cure, eye conjunctivitis is the cure, headache is the cure? Do you realize the meaning of all these things? So what did Hippocrates, and you, I mean, I don't know if everybody know about him, but he's considered as the father of medicine. What did he say? I'm having a small acute healing crisis. Give me a fever and I can cure every disease. So, once anybody understands the meaning of a fever and the importance of fever, nobody is going to, like, look at fever with fear, but they are going to invite fever with, with open hands, and they want to hug the fever. They want to, like, literally embrace the fever. So, in nature cures or among natural hygienists, if anybody has a fever, for example, if Asha rises a fever, or Dr. Gauri is going to say, I have a cold, then what do I usually say? Or Divyansh usually says, oh, congratulations, you guys are doing so well. You guys are healing, and then you guys are dumping out all this. I really wish even I rise a fever. And people around us who are strong believers of so-called germ theory, who don't understand much about fever, they're going to think about what kind of nuts are these people? What are they congratulating each other about? Why are they congratulating for a fever instead of, taking a medicine for a fever to stop it? They're all happy about it. They're celebrating a fever. Yes, natural hygiene, we celebrate a fever. We celebrate a fever. We celebrate a cold. We openly invite a diarrhea. We never fear any of them because we know that it is going to improve our health, take our health towards a more positive, more like at a higher level, to a higher level. So let's just understand the meaning of this. So far, are you guys with me so far? Because these are very hard concepts, not hard concepts, but when you have been conditioned to live in fear about fever and think about some kind of a destruction that is happening inside the body, all of us tend to live in fear, fear, fear all the time. But now there is no fear. It's all about celebration. It's totally, totally a celebration time. If your child is raising a fever, time to celebrate it, and then just wait for the more improvements that are going to take place in their health or even in your health, anybody's health. It is because what happens is you dump them out. You dump out buckets and buckets, millions and buckets of toxic material, garbage is going to come out. So a fever is a master cleanse in progress. So what kind of cleansing is going to happen is, so for children, it is mostly fever, a cold, a cough. What about adults? Adults also will have the same issue. Some diarrhea is also very common. So any hole that you have, any hole, let's see how many holes we have in the body. Nose is a hole, eyes are a hole, ears are a hole, mouth is a hole. Your skin, you have, do you know how many billions of pores the skin has? See, I have a lot of like rash over here, and I'm just celebrating a cleansing that is happening in my body because the pores are putting out all the toxic material. So every pore in the body, whenever it is going to put out all these buckets of toxins, this is an important event because it's like a Diwali decluttering. Remember, all your homes, every Diwali you declutter the house, and then you feel like, oh my god, the house becomes so livable now after you finish decluttering. Then what about a fever? What about a cold? With every change in season, just like how you clean up your home for every celebration, for every festival that is coming in, what about your body? Don't you want to clean up your body? So everything, change of seasons, summer to summer, spring to summer. What do you experience? There will be some diarrhea. And then whenever you're going from summer to rainy season, what do you have? All these fevers, right? People call them viral fever, this fever, newspapers write articles. Viral fevers are going up. Mosquitoes keep biting everybody, and everyone is having a fever, and the hospitals are filled up with fevers. No, it is all about a massive amount of decluttering that is happening in the community as the body is getting getting prepared for the next season. So after a travel, after a celebration, after some amount of stressful event, or whenever children are about to attain milestones, what happens to them? They raise a fever, they raise a cold, then all that garbage, all that filth, all those chemicals that are there in the system are going to be purged out so that they can prepare themselves for the next life event. So then they're going to achieve a milestone. They're going to start walking, they're going to start talking, then they're going to start getting their menstrual cycles, about to get a menstrual cycle time, menarche. Then they do all these cleanups. So you have to understand why this happens, what happens, rather than looking at them as a menace, right? Most of you are like, oh man, this kid is always raising a fever whenever we have plans, whenever we have a vacation, he is going to have a fever. Then immediately you rush the child to the doctor, the pediatrician puts a paracetamol. You guys don't even realize that the fever was the important event for him, much more than that vacation. And you need to let the child have his own fever and go through his fever crisis, go through his acute healing crisis. That's the most important thing for him. So anticipate them, welcome them, celebrate them, understand them, and go through the processes of acute healing crisis. This has to be done in order to improve our health. Otherwise, we are going to have more and more health crises that we're going to see later. So let's next slide, Asha. So are you with me so far? What is a fever? Fever is supposed to be celebrated. Fever is supposed to be invited, and you have to look at it as a blessing. So every acute disease is the result of natural cleaning efforts by the nature, as Dr. Gauri has said. Remember, buckets and buckets of toxins. The body can't handle any more of the toxic material. Then the body has to raise a fever. Body has to raise a cold. Body has to give the diarrhea in order to let all of those things out. So nature's efforts are only how do you attain better state of health? By cleaning up, by decreasing the load of toxic material in the body. So that's how you do it, by not dumping more chemicals, by not dumping all kinds of fancy superfoods. That doesn't happen. Only when you aid nature's efforts of cleanup, then only we attain better states of health. So everything, remember, whatever we eat, the garbage, the air pollution, the chemicals that are around us, all the the pharmaceuticals, the drugs that we have taken, all of them add lot of burden to the body, and they all have to go out of the system. So that's how the body cleans up. Body will not attain better state of health by keeping these millions and millions of buckets of toxins inside the body. You heal by releasing, but you don't heal by suppressing. What do we mean by suppression? Suppression means stopping a fever. How do you stop a fever? How do you stop a cold? How do you stop a diarrhea? When you stop them, you are interfering with the body's efforts of cleansing, and then you're not going to attain better state of health. You're going to attain lowered state of health, and you're not going to feel better if you stop any of them. Next slide. So, see, these are short notes that we are giving you. We have plenty of good information to share with you. But the thing is, theory is one thing, okay? We all can recite all these fever. Oh, yeah, fever is a blessing. Until we have a fever, or until our little one has a fever. And then all this theory is going to vanish. And then the fear of, oh my God, what is going to happen? What is next? No, that's what we are trying to educate everybody over here. First comes the theory and the philosophy and an understanding. Next comes the community support of helping you go through these things so that you guys are going to overcome your fear and understand what exactly to be done and how to, go through the processes of understanding this fever. So fever are the result of what happens with a fever. Can you guys give me some examples? So fever is raging fever. 103, 104 is happening. Then what happens? Why does the body increase its temperature like that? I mean, it doesn't feel good. It feels so horrible. The whole body is aching. You feel so thirsty. You don't feel like doing anything. And especially when you see your little one be that way, and then it's like your heart melts out, and you're like, no, 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 I have to be the parent. I need to do something in order to make my daughter or son feel better. But then why does the fever go up? Because remember what happens with liquids. When the liquids are at a higher temperature, they become more liquefied. So then what happens? All that stuck mucus, all that stuck filth and the garbage becomes more liquefied, and it will be able to, the toxic material will be able to come out through the skin. You're going to sweat it out. It is going to come out through the nose. All that mucus that is coming out, like, it's so smelly. It looks really filthy, right? And then all of it. And then the urine. How does the urine feel when you have a high fever? It feels so burning in sensation. Why does it burn? Because of all the acids and the toxins that are coming out. So every little bit of thick, chunky mucus that is locked up in the body, all that filth becomes liquefied and free flowing, and that's the purpose of body, to raise up the fever. So it is like, everything, every little bit of energy that the body has is focused on creating the fever, raising the fever. That's when the stomach is going to say, I can't eat, I can't eat. And then you forcefully feed the child. What will the child do? And then everything comes out. Then the mother is like, I fed him 3 times, I fed him 4 times. He's not able to keep anything in his mouth. And then look at him. My child is not like this. He's always like, playful, always doing something. I'm very scared. He hasn't, like, he's just not able to get out of the bed. But you need to understand that is his body trying to do all this. So whenever the child is always right, okay, you need to let the children, or you have to follow your own intuitions and your own instincts, rather than forcefully feeding yourself and doing all kinds of things that are totally against what the body has intended to do. So then this is the major thing. So fever, you should not be stopping a fever, you should not be feeding a fever, you should never be coming in the way of the fever. What happens when you stop a fever? By now, like, it is supposed to go up, and then once the cleanup is done, then it is going to come down. But then you're not going to let it go up at all. You're going to keep suppressing it with fever medications. Then what happens next? But then you forcefully feed a child everything, like, bread. Let's just feed him some bread. Okay, he's not able to retain bread. Let's give him some annam with like, rice with some rasam, and then you're going to feed him. Or let's give him some chicken noodle soup. Put it in his mouth. Then you are going to interfere with the fever. Then what is going to happen to the child or the person who is just forcefully fed like that? Next slide, Asha. So did you guys understand the meaning of a fever? Why it is so important for you to take care of the fever this way? You should not be coming in the fever, because when you suppress the fever, then the body is going to say, Arey, I was trying to clean up everything in the system and you didn't let me. Now what am I supposed to do? Then that's when the scavengers are going to come in. Remember, Dr. Gauri was just talking about the scavengers, the cockroaches, the rats, the mosquitoes. You know, when you don't clean up externally, like, you don't drain the water, you don't clean up the garbage tanks, what happens? Cockroaches will come in, mosquitoes will come in, rats will come in. Same thing. That's when the so-called typhoid bacteria, that's when the amoebic dysentery, that's when all these things are going to come in. Whenever you interfere with the fever, whenever you stop a fever from raising and cleaning up the body, then the next step would be to get into more and more so-called allopathic complications, like whatever you guys want to name them as: typhoid, dengue, chikungunya, whatever names you want to call them as. So the most important thing is to in terrain, like, now we all want to know more about terrain. So in terrain, what do you do is you are going to keep the fish in a cleaner environment. All you have to do is to remove yourself from the toxic environment, keep yourself in a cleaner environment, and that's how you do it. Okay, so next slide. So let's observe and learn. So when animals are sick, what do they do? Do you have any pets? Have you observed any animals? What do you do when they are sick? First thing is they do not eat. They do not eat anything. Immediately they kind of like go into a sun spot, and then they kind of like sun and a shade spot. They kind of rest. And maybe if there is little bit of water, do sips and sips of water, but they go to a quieter place and then they keep resting until they start feeling better. So the same thing for us also. So you don't have to constantly check the temperature, keep worrying about what is going on. And then all this commotion and everybody, especially when you have grandparents at home, they're like, Arey, hospital ko le jao, do this, doctor ko dikhao, do that, do this. And then the child is going to get very annoyed, irritated, and then you keep interfering with this fever activity of the body to raise the fever. And then again, paracetamol, the porridge, the rusk, the bread, all of it will add up. And then the body is going to say, Are Baba, I'm trying to raise a fever. Let me please focus on this fever. But no, we will not let the body do its job, and we keep interfering with it. And then that's when all these complications of so-called fear of fever are going to arise. When you don't suppress a fever, when you don't feed a fever, and when you let the body do its job, there is no fear of fever. Only a celebration of fever is going to take place. Yes, yes, I understand all your concerns. How high is too high? What do we do? How many days do we do all that? We're going to explain to that. And let me first finish my slides here. So the fever fears and the myths are: fever may spiral and injure the brain and cause delirium. See, all these years I have two children of my own, and then I have many cousins, all of them, and then all these health coachings that I have done. So the most important thing that is like, when a child is fed well, okay, when a child is fed well from the beginning, okay, from the beginning, and not on any kind of ultra processed foods, and when the parents are given enough amount of support by the community and by the health care, not by the sick care, not by the sick care who is always eager to offer suppression, but by the healthcare. I have never seen a fever spiral into higher and higher temperatures, and I've never seen any seizures. I have never seen any kind of brain injury or anything happen. Only when there is an interference, that's when I have seen a fever spiral. Because what the body is going to do is the body is going to say, okay, at 102, this patient, this body did not let me clean up. Now the paracetamol came in. The next round of fever, once the paracetamol wears off, I'm going to make the fever at 104, 105. So that's when the temperature body will know, and then the body is going to creep it up. But never, when a patient is guided on nature cure principles, I have never seen fever like spiral out. The spiraling out happens only when the suppression happens. And then the brain injury and all of these, there is another reason: because of the drugs that have been put in. And also, if the child has been given injectable chemicals, we're going to talk more about injectable chemicals. That's when the brain injury has taken place. This brain injury is going to deserve another huge big topic of discussion only after you guys master these basic principles of fever right now. And also, people say, oh, it's been 2 days, 3 days since the fever has been raising. And what do we do next? What do we do? The most important question we ask everyone is, how high? I mean, I'm sure you guys were checking the fever, right? So how high was the fever? Oh, yesterday it was 103. Then what is it today? It is 100, doctor. Then it has come down. And then how many episodes of fever did the child have yesterday? The child had 6 episodes of fever. What about today? How many episodes? Only 2 episodes and 100 degrees. That means it doesn't vanish. See, the thing is, it goes up gradually, it comes down. You all have to be very patient and very vigilant, and you should be in a position to maintain a fever diary journaling for your child. You will understand the pattern of fevers. Even for both my kids, they have totally different patterns of fevers, and I totally know their body. And actually, nowadays, they don't even tell me they have a fever. They take out a blanket, they sleep in the sun, they come inside, they drink water, and then they again then they say, I'm not eating anything today. You do what you have to do. I'm going to bed. So they will also understand. You train your child, you keep talking to your child, they will know what to do. And then the weight loss and weakness is also a concern. But weight loss will happen because the child is dumping out millions and millions of buckets of toxins. So weight loss is, of course, is going to happen. And then the child is sleeping too much. Doctor, my child used to be so playful, so much active. I don't know what to do. She's just clinging on to me. Yes, they will cling on to you. It is going to be an inconvenience for a day or two. But look at the biggest investment that you're going to get as a way of building up their health. So it's okay. We are parents. We can compromise on all these things. So the child is going to keep sleeping because I said, right, every bit of energy in the body is focused on raising a fever. So there won't be any energy given to the muscles, any energy given to the gut. So they can't eat. Whenever you feed them, they throw up. That is normal. And that is expected. And you should not be feeding a fever. So not eating at all. That is common because you, as I said, everything, every little bit is focused on filth cleaning. So imagine you are doing a Diwali decluttering today, and then your son comes and asks you to make a biryani. No, not biryani, but something else, like a big festival meal. What are you going to say? You're going to say, no, no, no. First, let me declutter. Then we're going to cook whatever you want to cook later on in a hygienic way. But we are not going to do two of them together at the same time. The same thing the body is also going to say. Don't worry, their weight will come back, their milestones will come back, everything will come back, but let the body do its job. And then the grandparents and the relatives influence, again, teach them. Teach them, teach them, teach them. Everybody need to be taught because the germ theory, Louis Pasteur, was very successful in contaminating all our brains and putting all these lies or the false theories in our head. And it's time we are all going to change. Like, big, there's a huge community, we are going to change it. So the most important thing is the guts have to be cleaned, as I said, right? With the most important part here at this point is, as I said, don't first, if the child is on a cleaner lifestyle, you're not going to see all these dramatic high fevers or all kinds of these things happen. So first of all, remove ultra processed foods from their diet without any kind of, like, once there is ultra processed foods in their gut, you've been feeding all these dairy, chocolate, and then ice creams, ultra processed foods like packaged foods and all these things, right? And dense cooked foods at home, then there will be lot of filth, lot of poop that is still in the gut, and then it will start fermenting, and that will lead to more and more higher fevers and more issues. And I mean, one day we have to talk about these measles and all of them. Maybe when we do the talk of vaccinations, we can talk all that. But again, when the gut is filled up with lot of putrefying material, like lot of old waste that is sitting in, that will result in all these fevers of rashes and measles and other kinds of things. So every child every child is prepared by fond, indulgent parent for all the sickness it will have in its childhood. So, yeah, so again, Dr. Tilden's words are really, like, like they are like a slap on the cheek for all the parents. But parents, so just because, like, you do all kinds of research about what kind of bedroom colors the child should have, what kind of toys the child should have, what kind of car seat. But first of all, get educated about these basic things: what to feed a child, how to raise a child, how to handle a fever. All these things are very much essential and have to be part of parenting manual. Next slide. So what do you do right now, right? So first of all, like, open air, and also no masking. We're going to talk more about all these things in the subsequent talks that we do. And natural sunlight, fresh air, blood purifier, sunlight, sunlight, sunlight. And also resting, not disturb. Do not disturb keep on disturbing the child. Nothing will happen to the child. You don't have to keep checking all the time about where the fever is. Just be there for the child. Talk to them in a pleasant way. Don't show them you're panicking and all that. Okay, if they ask ask for anything, initially offer sips and sips of room temperature water, clean room temperature water. And again, if you want to slowly advance their diet, once the fever spikes have come down, when the fever frequency has come down, then you're going to offer them some juicy fruits like maybe melon, maybe citruses, and coconut water. But don't, until they keep asking, don't give any kind of cooked dense foods or any of that. Make sure they had a bowel movement, even if it's they haven't had for 48 hours, that's fine. But the subsequently you should make sure they're going to have a proper bowel movement. And then again, isolation is not needed. Like, I have seen mothers mask their faces while they're breastfeeding the child, thinking that they are contagious, thinking that the mother who is having a cold is contagious, and that she's going to give her child. But there is nothing like a contagion, right? That's what Dr. Gauri has informed us right now. You don't catch anything. Everything is from inside your body, and it is the way the body cleans up. So don't worry about masking yourself or cleansing your hands with sanitizers or all kinds of nonsense, that the germ theory guys have been asking us to do. Nothing of that sort. Go into the fresh air, get the sunlight. It's okay not to eat for a couple of days. We have enough reserves in the body, and but make sure you are hydrated enough. Next. So this, yeah, Asha, I don't know if you want this. So when you stop a fever, what happens is when you stop a fever from happening, that's when it leads to complications. We see a lot of patients who come to us for health coaching, and most of the times it's like multiple fevers, multiple episodes of fevers that have been stopped, that has led to their chronic health issues. Later, once you don't let all this toxic material to come out of the body, where will they go? They go into deeper and deeper tissues of the body. They go to your joints, they go under the skin, they go to the liver, they go to the thyroid. Then that's when all these so-called health issues like, rheumatoid arthritis, lupus, whatever the liver issues are, everything has a name to it. But this is because we never let the toxins go out. Where are they going to go? They're going to go into deeper tissues. Then slowly the organ injuries, the organ failures, all these things are also going to happen. So, but this is a topic for next time, since you guys are just getting started on understanding what this is all about. So many a times, lot of parents come to us, lot of adults come to us asking us, how did my lupus start? How did my this rheumatoid arthritis start? What about this thyroid issue? What about cancer? I mean, I have followed a healthy lifestyle so far. It's not fair. Why do I have it? So this is the answer from all of us. Many a times they come and ask us, like sometimes they ask us, how did the cancer begin? So we all have only one answer. It begins with the suppression of the first cold or the first rash or the first fever of childhood. And then the first crisis the baby endures and that has been suppressed begins the seed for that cancer. So then it becomes life becomes an act of suppression of multiple symptoms, because we don't know, we don't understand how body works, and we never been taught about the importance of what all this is all about. So today you understood it's all about cleanup system in the body. It's all about hygiene. It's all about toxicity in the system. There is nothing that is external that is going to cause injury to the body or that is going to attack the body, but it is all our acts. Everything that we do put together will result in all these things. Cancer and disease in children seem extremely unfair, but there are many reasons why this happened. It's not just a random event, but it is multiple acts of suppression, multiple acts of accumulation of toxins that has resulted in what the current condition is right now. So we are trying our best to educate everybody. See, the minute you are here, you will be like, oh my God, this is all about decluttering, Diwali decluttering. This is all about celebration. Okay. Once you put down your laptop and you open your newspaper, once you turn on the TV, and once you start talking with the arm log, who are not even ready to listen to anybody, then you are like, again, you go back to the germ theory, the chemical warfare, putting more chemicals on the system, all these things. So again and again, what we are trying to tell you is more of the community support, more of repetition, and more of implementation needs to be done. It's not just about learning how to do it in, like, how you go to school, you learn something and you never use it. It should not be that way. So the learning curve here is the most important thing is never say, oh, I had a COVID. Everybody was saying, right, I'm going to test myself. Oh my God, I have COVID. Even if they don't have anything, even if they have a small sniffles, they're testing themselves and then they're saying they had COVID. And then there are people who said, oh, COVID is not nothing, it has been renamed as a flu. And then natural hygienists are like, Are Baba, you both are again confused. It's not COVID, it's not flu. What is it? Come on, guys. I already told you. Dr. Gauri just now introduced the new term. It is acute. Answer it. It's called a COVID, a flu, a Nipah, a SARS, I don't know, whatever name they want to call them as, monkeypox, or whatever names they're going to come up with. What are all these things? These are nothing but all natural hygienists have to proudly say acute healing crisis. It's your body that is cleaning up. It's all acute healing crisis. There is nothing that is going to come from outside. It's all by your body. The body is cleaning you up. Okay. So now let's move on to, I think this is my last slide, but I hope I made it like, sounded so, more dramatic so that it's going to stick to all of you. And for 5 years or for 6 years, we've been talking about all these. But again and again, the fear factor is so huge, okay? Fear is the most destructive energy of man. It really, like, that's what I was trying to tell you. You listen to all this story, and then the whole Ramayana is there in front of you. And once you turn off the laptop, again, you're going to say, who is Rama to Sita? Okay, who is Duryodhan in Ramayana? That's what you guys are going to talk again. Don't do this. Don't do this. Like, it's like, we are just going to, like, keep repeating the same thing. We keep hearing our same voices again and again. So it distorts your thought. Fear leads to all kinds of extraordinarily beliefs and myths and everything. Look at all of us. What did we do to ourselves? People were masking, double masking, it seems. They were fighting with each other. They were yelling at the children for coughing and sneezing in the balconies, thinking that there is a mythical virus that is going to jump onto us, that is going to destroy us. I mean, really, are we that weak that thinking that a non-living thing, the non-living thing, what is a virus? It can't even, according to them, it can't even live on its own without lodging onto somebody. How can that even exist? So Divyansh and then Prajakta will talk about all that. So fear, fear, fear. Turn on the TV, there is fear. Turn on your newspaper, there is fear. Talk to your government, there is fear. But don't live in fear, because you know the real reason of all these things. So, yeah, somehow we all came here.
Prashanti,
Mhm.
Dr. Prashanti, we have Poonam Garg who is here to speak
Yeah,
about how her
yeah,
daughter had fevers. And yeah, can somebody find where she is and please enable her video if somebody can
yeah.
help?
But I think everybody is labeled as Asha here.
No, no, but she's there. I just saw her. Poonam, can you
Okay.
switch on your video so I can? So thank you for your talk, Dr. Prashanti. It was very insightful. And after Poonam's, because she wanted to leave, we will take questions from all of you for Dr. Prashanti and Dr. Gauri. Um, Poonam, okay. Yes, go ahead.
Hello everyone. I just want to tell you about the healing journey of my daughter. And she was now 7 years old. Previously, when she was 4 years old, she got a high fever. It is because of the dairy products I have given to her. And when she was having very high fever, it was 103, as doctor suggested me. I gave her antibiotics, but it has deteriorated her health after that. She got alopecia and then eczema also. And then when I come to in contact with this Dr. Prashanti and Asha Shivaram, and they suggested me to follow the natural lifestyle. And then by following the natural lifestyle, I can correct my daughter's autoimmune diseases. And now whenever the fever comes, it is a good healing process. And I am happy that fever is a detoxification that body is doing. So and I always favor that fever is good for your health, and it is a good healing process. So whenever fever came, now I used to treat it in a natural way as doctor has suggested me. And by following natural lifestyle, we are free from medicines. And I suggest everybody that don't give your kids unnecessary medicines and it has a huge impact on the health of the kids. Thank you.
Thank you,
Oh,
Poonam.
Yeah, I mean, her story, we have recorded it. It's there with Valcure, but we can share more. But since we don't have a whole lot of time and a lot of discussion needs to be done, but I can tell you for sure that day the child was only 4 years old. But when I was taking her history, I have to finish almost 3 pages of her, like, 3 full pages as I was writing and writing. Antibiotic from the start of 18 months, rounds and rounds of paracetamol, suppression, antibiotics. There was no end to what was going on inside her. And then I was like, when is this going to end? Like, how is this going to end up? But I'm so glad they chose this path, and then they kind of like put two and two together and realized. But there are many more parents, all those pediatric wards that are lined up with these children with only with fever, acute healing crisis. Because, children have a lot of vitality in them. So they immediately clean up any kind of filth that comes into them. It's a major roadblock for their growth. So they have to clean up before the next milestone hits. So in that process, they kind of like raise an acute healing crisis very often, especially when they are raised in a very toxic environment. So that's, this is a huge, and this is a nice, beautiful science and observational science. Like, I don't understand how allopathy is totally missing the whole picture of it. It's just sad what
So,
they're
Dr.
doing to everybody.
Prashanthi, I think in relation to that, there are a couple of questions. Also, Dr. Gauri, if you are there, you could also answer. So, there's one question: how is it that germ theory became so popular then?
You will answer the
So
question.
prevalent
You
throughout the world.
Yeah, you will answer this question yourself then. Who is it? It's, I mean, the name. Hello, can you guys hear me? Yeah.
Shri Gupta is
Shri,
asking. Yeah,
Shri
Nikita.
Gupta. So, in the name of germs, what do you sell? In the name of germs, what do you sell? Then, see, if I'm going to talk about terrain, and tell you to take some sunlight, sunlight is free, fresh air is free, eating right is free, and not suppressing a fever and letting the fever go through its course is free. So, when will anything be popular? Only if you will be able to market it well. When you have a nice MBA who knows how to market it well, when there is a nice TV advertisement, and when there is a lot of funding to it, then only the germ theory, that's how it became very popular. See, the thing is, the beauty of germ theory is you give a paracetamol and then immediately the fever comes down. Then the parent can go on vacation, the parent can go to work, they can just forget about it. Then who cares if the child later on develops a cancer or rheumatoid arthritis or a lupus? Who cares about it? Because we don't remember any of it, and we don't even know that these two are interconnected until a natural hygienist comes and tells you what has happened. So this is how it happens, so that it is easy to market it, right? Market. Mother can go to work, father can on vacation, family can go on vacation if you stop a fever from coming, and then no days of work is lost. So, I mean, it's so easy to sell all these things in those names.
I
But
think
yeah.
there's a real practical question. I'll address it to Dr. Gauri. This is from
Mm-hmm.
parent Pushpa Babu. So, in case of special children who may develop a fever, she is saying it may be a bit scary to allow fever to go beyond 104 degrees if there is autism. I worry if the fever will cause a seizure. So, any experiences on that front, Dr. Gauri, and advice from
I
you?
would rather let this question be taken by Dr. Prashanthi.
Yeah. Okay. So, see. It's a very so it's what's the name? What's the name? Pushpa
Pushpa
Babu.
Babu. Pushpa
Yeah,
Babu.
Pushpa, I understand what where you're coming from. See, when in autism and all these conditions that you have, how is the gut of the child? Can you tell me the first of all, the most important thing I know to know is how is the gut of the child? See, most of the times, autism, as you know, it is the gut and the brain connection, right? When the gut of the child is totally filled up with lots and lots of old waste. And remember what I said, when there is a lot of old waste, usually they go through lots and lots of acute healing crisis. So what is the first and the most important prerequisite to that? We have to make sure that the gut of the child is clean. So what do? First is you change the diet of the child. You have to put the child on a less dense, less complex diet. First, you clean up the filth in the child, and as the child prepares himself or herself for a fever, then it will not be as dramatic as you are thinking it would be. Trust me, it always works because it's not, I mean, it's just a logical process. There is nothing to be like worried about medical liability issues or anything. First, make sure the gut of the child is very much clean, and then you watch a healing crisis go through, and the child actually will develop more milestones after the episode is over. Doesn't matter if it is special child or anything. Whatever you've been like the therapies that you're giving, immediately the child will start picking them up. Asha, don't you remember we have many children with us with so many so-called spectrum who are having gut and brain issues, and then once we cleaned up the child gut, and then how well they have done after an acute healing crisis.
Yes, true. Actually, after an acute healing crisis, they show a lot of development, both
Mm-hmm,
intellectually, in terms of their digestion, and they hit new milestones.
mm-hmm.
So it's really wonderful to see that. So that's why we say celebrate fevers, welcome them, anticipate them, and you will not regret it at all. So, there are many parents here with a lot of fear about 104, 105 degrees, what will happen, this, that. So, first, we would like to say, first, practice on yourself, right? So, you learn to handle fevers and other healing crises properly in the right way, and then you will get the confidence. So the parents have to have the proper education and practical experience, and then when a real acute healing crisis comes, you will not be in so much of fear, and not unable to make the right decisions. So some questions about masks and contagion and spreading, I think the further speakers will be addressing that, so we won't take it right now. I think there are some
There
questions
is a
about what.
Rakshata.
Yeah.
Yeah, sorry to interrupt. So yeah, go ahead, Asha. Are you there? It's
Yes, yes,
frozen.
I'm just seeing, but I think we should start with the next speaker. I think most of the
Okay.
questions are about high
The
fevers.
last question, yeah, last question is like, I'm an emergency physician and we come across children who develop febrile seizures for the first time without any medication. I understood the concept of fever spiral occurring with our own interventions, but what about those kids who are presenting for the very first time ever? How do we manage that? And what should be our advice to them? See, hey, Rakshat, so the most important thing about the febrile seizures is febrile seizures usually happen when the gut is literally filled up with lot of filth. Okay, so at that point, yes, you have to manage the fever, but try to reduce the intervention. How about you do like a wet, see the wet cloth and all of them, I'll talk later, but at least you can start with wet cloth and all instead of putting more and more chemicals into the child, and then immediately advise the patient not to feed but just to keep on water at that time. And moreover, when you take a proper history, you will always realize that these fevers, these febrile seizures usually happen after the child has been if you look at the history, usually there is a chemical injection, vaccination that was given to the child prior to the child raising a fever. So if history is important, and also there is no there is no customized plan for all these things. History, that's how it is. But the concept for the physician has to be the right concepts. Okay, so you can't just keep on moving, flip flopping here and there. But the thing is, you need to understand where it is coming from. But febrile seizures, 100% of the times, it's coming from lot of filth that is filled up in the gut. Most of the times, the child has eaten lot of garbage from outside, and that's when there is lot of gases and fermentation that is happening, and that will result in febrile seizures.
Okay, so we'll take the last question for both of you before we move to the other speakers. So if Dr. Gauri is there, Dr. Gauri, would you like to answer this? My 2.5-year-old is having fever but is not willing to hydrate himself. What do you suggest? This is from Neha Singh.
Okay, it is very important, as Dr. Prashanthi was speaking, at least to hydrate. And maybe you can use a spoon or an ink kind of a ink filler kind of a thing, and slowly put drops of water into the mouth of the child. And when it is dropping onto their mouth, no, it'll just get absorbed when they are not able to or want to sit and sip or drink water.
Yeah, and I'm going to say something like put a bowl of water in front of the child and let the child play with water. Okay. So as the child is playing with water, the splashes and splashes, mother can mimic and show how to drink water with their own two hands. So she will start licking her fingers and all. And then also through the skin also you will be able to absorb some amount of moisture, like hydration. So try it that way. That's how usually we encourage children to start, drink getting to the water part.
Okay, so shall we move to the next speaker? We are already at 9:05.
Oh yeah, let's go ahead.
Thank you, Dr. Gauri and Dr. Prashanthi. So next we have Dr. Prajakta.
Let me share my slide.
Yeah, I can't see your video.
Um, can you see my screen sharing?
No. No, nothing has come up yet.
Yeah, there's something with the screen. Can Divyansh take over for now? I'll just start with my screen then.
Okay. Yeah,
Yeah.
sure, no problem. So Divyansh, you can
Thank you, Asha.
present.
Okay, I'll share my screen.
Do you want me to share?
Just give me a minute. I think, yeah. Is my screen visible
It's
to
coming
everyone?
up. Yeah, it's come.
Okay, wonderful. So thanks to Dr. Prashanthi, Asha, and Gauriji for presenting a lot of insights on the nature cure, the germ theory, the Deuterian theory. I know a lot of you joined a little late. So what I'm going to cover, so who am I? As Asha already introduced, I'm just a common person like you all, who grew up seeing a lot of diseases in the family and a lot of traumas. And then I had a child 2.5 years back, who's been born vaccine free and allopathy free or any other pathy free, is being raised on nature cure and is very healthy and very well sorry. So yeah, okay, so that's my story. I've learned a lot in the due course because I promised something to my son, that I will never let you see the face of a hospital or severity in diseases. So I took all the time out to learn what diseases are, which we are not taught actually in school. The basics of how diseases happen, the basics of how the toxins, what Gauriji and Prashanthi was talking about, that all diseases are one, all cure for diseases is one, is something is related to the lymphatic system of the body, which they don't cover in the school. And if you understand the lymphatic system, you will know that it all diseases, uh, coughing to skin issues to everything, has to do with body's attempt to remove the mucus or the dirt from the body, and that's what diseases are. So sorry, Asha, my screen is being changed. Is Are you also clicking on it, because it's constantly changing? Okay, so what before I come to polymorphism of microbes, let me just throw this question to you. I know all of you have this question on your mind, that if it's not bacteria or virus, then how is it that they're always present in the test and all? So that's something Prajakta will cover on the floor of the test. Before that, I'm gonna tell you something. We all have dustbins at home, right? Do you have cockroaches, rats, flies, insects coming into your home where you keep your dustbins? Well, if yes, then you have to question, are the cockroaches, flies, mosquitoes the cause of the disease, uh, or the cause of the smell or the bad smell that you get in the house once the garbage is being decaying for days and days? No, it's the garbage, right? So same as our body. When there is garbage inside a body, the body will obviously activate all its channels to cleanse and detox. But when the load gets really high for various reasons, as explained by Gauriji and Prashanthi, then the friends come into the picture. These friends are called pathogens, microbes.
Divyansh, sorry to interrupt, but are you moving the slides? Because I
No,
only see the first one.
no, my slides are being moved automatically. Now, do you see the second slide, Ashaji?
No,
No, I don't see anything. It says Divyansh Gupta has paused screen sharing.
Hold on, let
no,
me.
no. I only see fever versus fear, the first slide only.
Okay, I will just
I think
re.
maybe you have to do it manually.
I have just reloaded the slide. Do
Yeah,
you
yeah.
see the
Now
second
the
slide
second.
now?
Yes.
Okay, wonderful. Yeah. So these microbes, these pathogens are all our friends, which are omnipresent. They are almost there in all our bodies, different animals, different humans. From the time a baby is born naturally from the vagina of a woman. And we all know about natural pregnancies, that when a baby is born through the vagina, they they take over, they borrow the bacteriums of the mother's vagina. So why is it good then? Like, why is natural pregnancy good then? That is why it is said that it is important and it is necessary. That's how the nature has designed it to be. And then the baby is breastfed, and the best thing about breastfed baby is the breast milk contains a variety of bacteria and pathogens, which we don't boil and pasteurize, right? The baby directly drinks it. And that's what any lactation expert will tell you, that mother's milk is the best. Those pathogens you don't get in any other artificial milk that you get as a powdered milk. So the story begins from there. Why am I telling you this? Because the nature has a system, has a design. And out here, we are there, humans, who are questioning that whatever the nature is doing is wrong. The body is flawed. The design of the nature is wrong. Nature or God, whoever it is, but it is wrong. That's what we are saying. That's something to ponder about. Why would it put so many bacteria and different pathogens inside a body? And why is it good then? So here's the thing. There were studies, as rightly mentioned by Gauri and Prashanthi, about Louis Pasteur and Antoine Béchamp, who did a lot of studies. Antoine Béchamp also released a book on pleomorphism. Pleomorphism or polymorphism is a study which proved that microbes can change their forms from one form of bacteria to another form of bacteria. Sounds interesting? They can change to a mold or a fungus or a yeast. So they are omnipresent inside your body, but they change forms and they rapidly increase in number. When the toxin load is high, they come to help you as friends, and they eat up the toxins. And also the toxins create dead cells in your body, so they help eat up the dead cells and eventually eliminate it from the body. So that's the whole process. So this is a very detailed subject and science, but I'm gonna make it as easy as possible. So these are nature scavengers that come into your body and help you. That's why gut microbiome is good. That's why gut microbiome is important. You need prebiotics and not antibiotics. Prebiotics is something which is pro-life, probiotics and prebiotics, which gives you life. Antibiotics is something against life. So to be living, you need to eat living foods. You need prebiotics. You don't need something to kill life inside you, right? So that's the whole idea of contagion and falling sick. So the whole idea of contagion was flawed. The way they have explained in the last 500 years, 300 to 500 years, and it has been proven, and there have been many books, but censored by the big farmers and a lot of other things. So we'll keep sharing these studies in the group eventually, so that you all have more insights. You can take out more time to study it. So the smallest form of the cell is called microzyma, from which the polymorphism happens of bacteria changing. And this has been studied under microscopes. This has been studied. So germs are your friends. Don't stop using all the chemicals to kill your friends. Okay, that's what I wanted to tell. Now, coming to the third slide again. Do microbes really cause fever, or are they just omnipresent when the fever is happening? That's the question you need to ask. So again, it has never been proven that microbes have been the causation of any disease. And take my word for it, we have a lot of studies to share with you all on this, that they have never been able to prove that the microbes have actually caused the disease. The most important thing is that what the pharmacists, the pharmacologists have to follow is called the Koch postulates, which I guess Prajakta will also speak about, in which certain conditions have to be met. Now, they never test in a very clean environment. That's something I will cover in the next slide. Yeah, that's the Koch postulate I was talking about. So there are 4 conditions that have to be followed. Now, what they do is they take out blood sample from a diseased person, and they mix it in a chemical, a concoction of chemicals. And the moment the living cell is taken out from your body in the outside environment, it has to die. So it disintegrates, and when it disintegrates, the DNA breaks up. It may break into RNA, and they may call it a virus, because most of the viruses are ribonucleic acid, right? And they will just tag it as a virus. So the way virus is defined is very flawed. So again, a very detailed subject, but it's not the virus that they show you in a picture that's going to attack you and kill you, right? So these are just fragments of your cells that they call by various names. And so the 4 conditions of Koch postulates are never met. Trust me for that. A lot of experiments have happened where diseased person's blood or a cell has been reintroduced into a healthy person, and he's not got the disease at all. That's the main crux of the slide that you are watching on your screen right now. So it's all based on assumptions and a lot of flawed algorithms and methods. You need to study this more. Keep a screenshot of this slide, and you can do your own research on what I'm talking about, as we will also share it in the future on the group. Now, the history of immunization. They have, how the beautiful marketing campaigns have over the years and decades parroted the whole narrative that polio was eradicated, measles was eradicated, smallpox was eradicated, whooping cough, and various diseases, like a success story, and with all the Amitabh Bachchans coming on the screen and telling you, right? So those are programmings that has been done. The fact is far from the reality is far from what has been told to you. Again, this was documented by various scientists in their researches, and what you see on your screen, take a screenshot of this. The vaccines were mostly introduced when the decline was happening of the disease, when it was almost a flat curve. The vaccine was introduced, and they took the credit that the vaccine kind of flattened the curve. That's the reality. So we have the graphs. They're there on, it's internationally there. It can be cross-checked. So, and then various other things. For polio, it's a very, very detailed thing, how they manipulated the definition of polio, how they changed the definition of polio to bring down the numbers. And then they called it various names like GBS and Bell's palsy and various other types of paralysis, partial paralysis and all. So it very conveniently, they reduced the number of polio cases by changing the definition, while polio continued and the paralysis continued and more so increased by the names of different things like GBS or Bell's palsy and various other syndromes, paralysis and neurological syndromes, when the vaccines increased in US and other countries. So yeah, for example, do you know 95% of world's active polio cases are caused by the polio vaccine derived virus, the so-called virus, but polio vaccine derived. This can be fact checked again. The numbers are out there on the WHO website, but yeah, they will have their own narrative of what's manipulation. So you need a lot of mental bandwidth to understand this, spend a lot of time, clarity of thoughts, and you will see that they're trying to confuse you by taking with whatever is being whatever the reality is. So that's on the vaccines history. Louis Pasteur as the father of immunization, right? And Gauri ji already mentioned that on his deathbed he agreed that terrain theory holds true, but the truth was that he copied and he stole works of Antoine Beckham, who later on went on to him and said, hey, I did more research and I found out the cause of the disease is the toxins. So can you also publish this and take away the Nobel Prize? It's okay, I don't want the credits. He didn't do that because by that time he had monetized the vaccinations. He was getting major kickbacks from across the big pharmas. So yeah, that's Louis Pasteur. And it was also, there is accusations of he manipulating the data on rabies. And that's why rabies has never been proven to be caused by a virus, by the way. So that's another thing. So it's all toxemia, the dogs falling sick. And I know most important question that many of you must be thinking, and which I used to ask, is that if this is not contagious, then why is it that I start sneezing and I get cough and my child gets it, or my child gets it and then I get it and my wife gets it? And why is it that everyone in the same area gets it? So it has two reasons. One, your environment is same. You're eating the same food, you're drinking the same water, you're inhaling the same air, you're exposed to the same radiation, toxicity, EMFs, and you're using the same products in the house. So that's the reason you are in the same environment and you have kind of same epigenetics if you are in the same family. Even if not, then everyone around is exposed to the same toxic environment. Number one. Number two, we have something which we will cover in the future sessions is parasympathetic and sympathetic nervous system. Immune system, nervous system, immune system, which kind of talks to each other. We talk to trees, trees talk to us, the plants, the other animals, we talk to each other. We have alpha beta rays being emitted here. We have neuro messengers being emitted through our bodies. So, when I yawn, do you remember in class, one used to yawn and everyone else used to yawn? Do you all remember that? Yes, that's related to what I'm talking about. Do you know many women get periods at the same time when they stay together, they sink in? You know why that happens? It's because your bodies talk to each other. So if I have the same toxins and my son has the same toxins, there is high probability that the detox route will be similar for both of us, sneezing or fever or loose motions or whatsoever. So that's a very detailed subject again, but just wanted to give you a cue on that because many of you will have this question, because I had that question. Why did I get chickenpox when everyone had chickenpox if germ theory is not true? And this got me my answers when I studied it in detail. I'll keep it brief and move on. Now, what about vaccines? I already showed you the graph about vaccines. Now, the most important question, there are 35 questions that we have listed. What you need to ask yourself and the doctors before you decide to go ahead and give vaccines to your kid or yourself. But before that, the main question is, ask what's in it. Today we are talking about label padega India. Are you even do you even see a label on vaccine? Why are they hiding it? You all got COVID vaccines. Did you even read the label? Like what's in it? No. Did the doctor even tell you? No. Did the doctor even hand over a insert black box warning to you, which says what are the contraindications, who shouldn't get it, what are the ingredients, what are the probable side effects, what are the rare and the common side effects, what should you do if you get it? No, you didn't. For your children, did they tell you? No. So that's I see that as a sin. You need to ask these questions yourself, to yourself and to the doctor, that what's in it. If you don't ingest it through your mouth, then why would you inject it? Is the simple question that I ask. I, as a vegan, I don't consume any animal derived products. So why would I allow another animal or human's cell to be injected inside my body? Fetal bovine serum is used in almost every drug manufacturing or research or in the development, which is from the cow. And how it is made, you can all check it on YouTube. Fetal bovine serum. It's against our belief system. Anyways, there's a lot more. You can research more about the ingredients and their side effects. So you got to study the toxicology of each of these. I mean, I ask this question to everyone. Will you consume mercury? Would you consume formaldehyde directly in your food? No. So why through the vaccines? And again, cumulatively, it's a big number. To see that, look at this slide. Again, take a screenshot. In the first 6 years of your child's life, this is the amount of the chemicals that your child gets it. And then we wonder, why is it getting eczema? Why is he getting so much of severe fevers and loose motions and vomitings and eye infections, ear infections, and asthmas and bronchitis? So here's a clue for you. So when you study these ingredients, you will understand how toxic they are. And so you got to remember, a baby, when it is born, it carries toxins from the mother's womb. The father's and the mother's toxins also get passed on. And in the initial few months, the baby, for hundreds and thousands of years, will try to detox. And that's how we have worshipped all the matas, like chicken pox or smallpox. We used to say that mata hai, and we used to just sit down and worship and take care of the baby. We would, or the adult, we would not actually interfere or fight the disease. We don't fight the disease. These diseases are your friend. So when the fever comes, as Prashanthi rightly mentioned, we celebrate it. The main thing is the fear psychosis. If you let the fear psychosis of the diseases affect you, then trust me, it will get worse. The body will not be able to eliminate efficiently. So you got to calm down, take a deep breath, connect with nature of all the 5 elements, let the sun be there, air, water, and let the body do its job. And trust me, you'll be fine. But study health in the coming days. Don't wait for the emergency to happen and then ask questions. Take this time out to study. Take out time from your work. No one's gonna. Don't outsource your health and education. Yeah. Okay. So is it all theory? No, this is not all theory.
Divyansh, just a time check. I think
Yeah.
we need to wind up. Soon.
Another 5
Yeah.
minutes. 5 minutes.
Okay.
So what you see, Dr. Paul Thomas has said that 13,000 children as a pediatrician. He's seen that the unvaccinated children have been healthier than vaccinated children. That's just Paul Thomas. There are at least a dozen more studies that prove that unvaccinated children have lesser diseases or lesser severe cases than any vaccinated children in the long run. So that can be studied. We will keep sharing the links. 12 reasons why to reject vaccination. As I mentioned, they don't honor the various conditions of that they need to do. So again, you can take a screenshot of this. Remember, none of them have been safe. MMR, one of the MMR injections, the vaccines, the inserts that you see, they took it down because people were afraid after reading this. It included all these seizures and disorders and liver failures and everything, blood clots. Oral polio vaccines cause paralysis. This has been proven as well. And Dr. Jacob Pullil has published a good white paper on this. And he resigned from NTGAI after government did not pay heed to his exposure. So I'll just keep it simple. When a flower doesn't bloom, you fix the environment, the water, the air, the sunlight. You don't fiddle with the flower, right? You don't inject the color into the flower. You don't put spray or perfume into it. So focus on the environment. That is terrain theory. I will leave you all with this thought, but allow me 5 more minutes. COVID, it has been out there in the open. It causes heart attacks, brain strokes, cardiac arrest, blood clots. It's official, and it has been banned. A lot of these vaccines have been banned, including our made in India Covishield has been banned in 24 countries. So you got to ask. You should do this risk benefit analysis. Will it stop me from getting the disease? Yes or no? Will it stop me from spreading this disease? Yes or no? Has there been a long-term safety trials been done on humans? Yes or no? Has been there any deaths and injuries caused till date by this vaccine? Yes or no? And are the makers or the government liable for any damage or injury caused? Yes or no? So when you get your answers to this, you will know whether what is the risk to the benefit analysis, and you should take your call. You are the doctor, so you should know it. Ask more questions. Okay. Important question. Most of the parents and people I come across, they feel that vaccines are mandatory because the school is asking for the certificate, because the office is asking for it. Remember, or your apartment is asking for it. It is not mandatory. If anybody is forcing you to take it or devoiding you of any services, it is illegal. It is against the Constitution. It is against the Supreme Court judgment dated May 11, 2022. Dr. Jacob Pullil versus Union of India. It's a beautiful judgment. You all can check this out on Awaken India Movement website also, or directly on the Supreme Court website. So remember, there are global laws and there are various laws which protect you. You have the right to choose which line of treatment you want to choose and what you put inside your body as a vegetarian or vegan or a naturalist. You don't want to put toxins inside your body. It's your choice. You don't want to risk your life by taking those toxins. It's your choice. Okay. So take informed decisions, weigh the pros and cons, risk and benefits, ask relevant questions. We'll share more questions with you. Use the resources. We have a lot of resources on awakenindiamovement.com. You get legal resources. You will get templates that you can send to the school. They will not dare ask you again or your child to be vaccinated. Trust me for this. Yeah. So know it. I have confronted many doctors openly and they don't have the answers. They don't even learn about vaccines much in the college MBBS time. Anyways, so I will just end this and wrap this up, Asha. There is a Sanskrit shlok from Vedas that you see on my screen, which actually means that whenever your body is diseased, जब जब शरीर व्याघ्रित होता है, तो then the only medicine is Ganga Jal, meaning water. Because olden times, every river was holy, be it Krishna, Kaveri or Ganga. And the only Vaidya or the doctor is Bhagwan Hari, which simply means that nature or God is your doctor and water is your medicine. Because now where it goes back, the translation can vary. The real translation actually means that by default, you lose your senses of taste and senses. So you don't feel like eating anything. So by nature, your body goes into fasting. So you start drinking water or you hydrate yourself. And when you give rest to yourself by being only on water and listen to your body, you don't overly feed or forcefully feed yourself, you'll be fine. And then you keep your mind calm, pray to the God, meditate, nature, whatsoever. Get into that mode of calmness, you will be fine. But when you have fear psychosis, the nocebo and the placebo kills you. The fear factor can actually take down your state of health and the ability to remove the toxins from your body. So don't fear the fevers. My child has gone through fevers. We have not risked anything. We have, on the contrary, prevented him from any risk of the paracetamols and the dolos and the cough syrups and the vaccines. So trust me with that, they'll be fine. All they need is natural exposure. And if you follow the principles of nature cure on food and all the other habits, all adults and kids will be fine. Thank you, Asha. I'll like to conclude this here.
Okay.
Thank you, Divyansh, for this very insightful presentation. Obviously, this is a very technical topic with a lot of things we still have to learn. So, if all of you are interested, we should definitely have another session on this.
Yes.
So, any questions? Otherwise,
Can I take the last topic and
yeah,
then?
yeah. Then we can do it together. Please go
Yeah, we can
ahead.
do it.
Sure. So, like till now, Dr. Prashanthi, Divyansh, and everyone has explained you about the terrain and how it is affecting our health, and it's not the germ theory. So yeah,
Divyansh, could
but
you stop sharing? Yeah.
yeah, okay. So I'll start sharing. My screen is visible, right?
Yes.
Just give me a second. Yeah. So I'll be just covering the medical part. Since many people are here, and even after they get fevers, everybody's like, at least get tested. Everybody is saying, giving you that suggestion that at least get tested, even if you have fevers or whatever. So I'll just cover the testing part. What every allopathic practitioner who's done MBBS and further studies do this. So next slide. So basically, fever, as you know, that it is created by your own body, and the center is located in your brain. So that is called hypothalamus. Next is like our body generates heat by muscle movement and the basic metabolic activity. Whatever the chemical reactions, digestion happens in our body, like we notice after eating some spicy, heavy, densely cooked food, we start sweating. So the heat is generated in our body for this digestion. While we do the exercises, our body generates heat, and the heat is also lost by conduction, convection, that you put on a fan, and you sit in touch with the surface, like you sit on a sofa and sofa becomes warm. So that is conduction. Then second is convection, and the third is evaporation. That after you get a fever, when you get a sweating, the fever settles down. So, or you just do the wet wipes on the during the fever. By evaporation, the heat is lost. So according to the medical books, it said that something triggers the hypothalamus to uh, the balance of heat generation by heat conservation. It is disturbed, and that is why we get fever. And there can be various possibilities that the practitioner tries to rule out, that whether it is a bacteria, virus, but we know that nothing such exists, because it's all the toxins accumulated in your body. So now, why fever? So it is also written in the medical books that it is the body itself which increases the temperature for the increasing the chance of survival. It is very essential for whatever bacterial growth is happening in your body. Like even if they do the culture sensitivity test, that they put the bacterial culture of your blood or of your urine sample, stool sample. So they say, see, this bacteria has grown from your sample. So it is because your body has created some toxic conditions for those bacteria to grow. So bacteria is everywhere. Even if you wash your hands 100 times and you are going out, you're going to touch something or the else, and the bacteria is going to be everywhere on your body. But it's similar to your home. If it is not well ventilated, it is not cleaned, it is dampened, and you're throwing wasteful substances, matter in the home, and you're not cleaning the room. So there will the fungus and bacteria will also grow inside the room. And now you cannot spray antibacterials and antifungals in your room. It will kill the fungal growth and the bacterial growth in the room, but the root cause why they were growing is not solved. So after few months, after 6 months, it's again going to have that recurrent issue that your room will be filled of bacteria and fungal growth. So the main thing that we need to focus is clean terrain, that is clean internal body, and not blame those microorganisms for their growth at those places. So usually the diagnosis in medical fraternity, it is done basis on how the fever pattern is, but it will be affected if you interfere. Like on the right side, it is like antipyretics, that is the drugs which stop the fever, paracetamol and all, steroids, antibiotics, these all interfere with the fever, and that is why the fever pattern in various patients can vary because of consumption of these substances. So everybody will not get the same degree of fever or same frequency. Some might get it throughout the day, some might get it at the night, only at the night, and they will be fine throughout the day. So it varies, and fever can be absent in it's all these texts are from medical books. So fever can be absent in seriously ill newborns, elderly patients, uremic patients, as in like they have kidney issues, and patients who are receiving the steroids and anti-inflammatory drugs and antipyretic, anti-fever drugs. So why? Because these things have made that person's vitality extremely low. Elderly patients have been through a lot of separations and lot of accumulation of toxin, and these newborns going through a lot of vaccinations, so they are seriously ill. And all these, if you see the corticosteroid, the drugs the patients are, if they are taking, so the fever can be absent in these patients because the body has stopped its attempt to heal from the crisis. So fever is a good thing, but if it does not happen, then one might be in one of these conditions. Because some people say that I'm very healthy, since 3-4 years I have not got any fever. So you need to look that not getting a fever is an issue, because your body is not trying, or it's not putting any attempt kind of to cleanse itself. So it will come out in some another format, like it might come out as a eczema, it might come out as any other infection, or it might be affecting terminally some internal organ of your body. Then we'll go to the test, like what people say that you should be doing, and by those tests the doctor confirms that, oh, you might be having these diseases. So usually when somebody has a fever, they suspect that it is a viral fever, but since we have debunked that there is nothing non-living substance like the virus which can jump on you and create some sickness. So it can be a viral fever, it can be a dengue is also a virus, so it will come under that. Then malaria, they say that there is a malarial parasite, or they say that your WBCs are fighting against a bacteria. So what actually they do in the test, I'll cover that. So they take your sample and they do this CBC, that is complete blood count, where they do the WBC, RBC, hemoglobin, all these tests. So these are actually the number of WBC during the fevers, the neutrophils, lymphocytes, the white blood cells increase. They increase because the body is requiring them to clean up the waste from the body, while the platelet counts can be lower. Sometimes the platelets can be lower. So platelets have a function to stop bleeding in the body, or wherever there is injury, they accumulate at that place, so that the primary first aid of that affected area can be done. So that is why when your body is cleaning, there can be some injury inside or something, then the platelet count comes down, and there is nothing to fear about it. Like many people say that their platelet has dropped to 1 lakh or 80,000, and they get very scared and they just go to hospital because they do this basic test of CBC, and they say that, oh, my platelet has dropped to 80,000. According to the medical book, I have not written the reference here, but it is 10,000, the count of platelet until 10,000, it's nothing to worry. And below 10,000, you can, additionally supply platelets from the blood bank. But till 50,000, even till 40,000, there is no urgent emergency to put any platelets or any drugs in your body, because your body is using your platelet, whatever is stores in your body, the platelet stores are being used to heal. So that is why they are coming down, and after a few days they again start rising up, because your body keeps on producing it. So there's nothing to worry or add additionally from outside. And then they do the second test, is that called C-reactive protein. So when your body is having inflammation or it is going through a healing crisis, you can see this CRP test, it has increased in number. So if you're thinking that if your body is having inflammation currently and you want to check, you can go for this test, the CRP test, C-reactive protein, which will tell you if it is more than 3, it is a high risk that you are having a good amount of inflammation in the body. It should be less than 1. Then the next test is ESR. ESR, basically it is your red blood cells. There, as you see, this lady is holding the blood. So the red blood cells are called erythrocytes. That is why it is called ESR, sedimentation rate. So they fall down to the bottom of the test tube, and how much time they take for it. So in inflammatory conditions, they settle down very fast to the base of the test tube. So ESR and CRP are done together to confirm the inflammation. But CRP is a better test to do. ESR can be wrong, because in anemic patients also ESR can be high. So that's all of what I've written here. Then next is the malaria, what I'll be covering. That whenever you do a malaria test, this is the rapid antigen test, whatever they do. And where you can see is this round color buffer hole where you put the blood drop, and then it goes, and the result window shows 2 lines. One is the control line, that whatever they have made the kit of, it is working, so that control line, and test line shows that you might be having some malarial infection as per the protocol there. Now here, if you look at the research, so they I just took out the conclusion part of the research, that this gave high false negative test. That means even if somebody is having malaria, this test can show negative as per them. So there is no such reliability that you are having malaria and this test will show that you are having malaria, or vice versa, that even if it shows positive, it's not confirmed test that you might be having the same. So how much you have to trust this things for your fever, because this is the test you will be doing for fever and you will be worried. So accordingly, I don't think, because it's all antigen antibody thing, which is a very deeper topic again to discuss here right now. And the next thing is efficacy also, that this means that this RDTA kit, rapid diagnostic test kit, is capable of detecting only 29 out of 100 children with malaria infection. If there are 100 children with malaria infection, only 29 can be found out, rest all will be shown negative. So there is no such reliability on this test. Efficacy is very low. And then there are dengue tests. So what they do in the dengue test is this NS1. This is also a kind of a protein. You can see in the second line, it's a non-structural protein, as they say, by virus or whatever. But again, in the last line, you can see the NS1 protein can be present in a non-disease state. Whenever you are not sick, that time also it can be present. And then they say why it is present. So they are giving that reason, that it might be because of vaccination, or you might you might have had fever last time. So from that, you might have developed that antibody, and that is why it might be existing in your blood. So it can be present in non-disease state and in disease state. So it does not indicate any presence of active disease. And then another test what you do for dengue is IgM and IgG. These are also antibodies. And the second point, you can see it's possible to have both IgG and IgM antibodies in non-disease states as well. And again, they say by past infections or vaccination, because IgM can be there in your body. So all these tests cannot clearly tell that you have dengue or malaria, but it's said that oh, IgM or IgG or NS1 is there, then we'll call it dengue and we'll treat it according to the dengue protocol. And when we'll be having this malaria ka test positive, we will treat it according to malaria protocol. There is nothing that we can visually see and tell that you are having this sickness. So all the lab tests, whenever you see the lab test reports, you can see the last line on the lab test reports. All lab tests are to be correlated with the symptoms, with the clinical symptoms. So even if you're having all the lab tests, and many patients come to me and they say that, you know, we are having this reports positive, what should we do? Having those reports positive means nothing, because in clinical diagnosis, if you want to get diagnosed with any condition, then your symptoms and your reports will be added up, and according to protocol, this symptom and this report will correlate, and we'll say that okay, this is the disease. But it's all about terrain. You can help your body be in a good healthy state, and you can always, you know, keep a check on what you are eating, how you are living, and keep your body internally clean. You don't need to do any of these tests, except for the CRP, because it's a good diagnostic test to indicate that your body has inflammation. Rest all, you cannot be diagnosed with any kind of this diseases. So this is all about fever diagnostic tests, what I had to cover. Thank you.
Wonderful presentation, Prajakta. Like lot of new information you have presented. So thanks a lot for that. And thanks to all of you who stayed so far. So can we take questions for another 5 minutes?
Yeah.
So guys, any questions for all the speakers are here? Divyansh, Prashanthi, I think Dr. Gauri has left, and Prajakta. So Ashish Mishra says the seminar were awesome. Okay, Dr. Gauri is also here. Yeah, thank you guys. Thank you all for staying. Actually, I have a summary slide and a quiz. I don't know if we have time for that, but we'll give preference to the questions first. Eye opener says Arpit. Yes, we will be sharing the recording.
Yeah, so again, if the body is doing its own cleanup, then what are we testing for? First of all, if we understand the terrain theory very well, why do we have to test it? What are we achieving by testing it? We know that we are not supposed to come in the way of the body. What's the name, or what is the point of naming it as Prashanthi, Asha, Dr. Gauri, or Divyansh, or whatever it is? Because there's no point in naming them, right? So what is the point of testing if the test itself is confusing? And do you guys even know, with all the testing, like, they take your own blood and they put some reagents in it, like chemicals. We don't even know some of the chemicals. I have no idea how they came up with the idea that they can put so X, Y, and Z chemical in order to create an X, Y, and Z reaction in order to find out that this is the cause of that. Because once you take a blood and then you put all these chemicals in it, like, do you really think it will be authentic, real part of what piece of what you are? I mean, can they imitate everything in a lab? What really happens in the body? Inside the body, there will be multiple different things that are at play. But once you extract it out and you put it in a test tube, and then you put all these chemical concoctions on top of that blood, and then you keep shaking the bottle, you keep exposing it to different temperatures, you keep doing all kinds of things on it, cooking it. Basically, you're cooking the blood sample. Whatever the amalgam it is going to turn out into, how do we control anything? So again, they themselves have no answers to what they are talking about, or to all these questions. They are confused themselves. And if you really look at it, last 5 years, the entire PCR fraud, you will see what has happened with the PCR fraud. So the cycle length is the one that is going to determine. So one state was saying they were going to see if you want to call it as a negative, you just increase the cycle length, and then it's going to just get diluted. And if you shorten the duration of it, then you're going to get a better, then you're going to get a positive test. So Yeah, again, there is,
Yeah, I
see,
think
until.
there are so many involved topics here, and it takes a lot of
Mm-hmm,
time to unlearn and
mm-hmm.
understand these things. So, guys, many of you have like practical questions. What I would like to say is, Dr. Gauri, Prajakta, then Dr. Prashanthi, myself, Divyansh, we are all there to help you. Many of us do holistic health coaching. So
Yeah.
you can approach any one of us to take more coaching or to understand it in more detail and actually implement it for your family and yourself. Because, yeah, having the knowledge is one thing, but actually doing it is what will get you the results. So you can approach any one of us for more detailed coaching, especially, many of you will need hand holding when there is fever and other things happening, either for you or your kids or in your family. Okay.
I would like to answer one question, which I guess it's for me, that regarding CRP. So it can be reduced. My mom literally had CRP. I got it tested because she had some pain in her body, and in March, like last to last month, I got it tested, and it was 19. And today, if I check, like last week we checked her CRP, it's less than 1. So I've put her on a very holistic lifestyle and diet right now. So CRP can be reduced. There is no medication which can detox you. Only your right food can do that for you.
So,
And
yeah, that's right. In fact, as Dr. Arun Sharma says, the father of nature cure now, that don't check your body, check your habits. First you understand what CRP is. If you don't understand CRP, then you will have the fear psychosis, right? Oh, my CRP is high
yeah,
and is high and that. So CRP is just an indicator of inflammation in the body. It can be heart, it can be liver, it can be any organ. So focus on inflammation. Why is the inflammation happening? There is some food or toxins in your body which your body is not happy with. So I used to have liver inflammation and heart inflammation when I turned 30. Today I am absolutely fit and fine. All my organs are much better, so I don't check anymore. You got to stop checking your body and start focusing on the habits, and you'll be fine.
so
Okay,
we
so
all
we
are
have
there
a
in the
couple of
group. You can reach out
questions.
to us, and yeah.
Yeah, we are reaching 10 o'clock, so we can just
We,
take the last two questions and wind up the session. So one question for you, Dr. Gauri, is I haven't raised a fever in 3 years. What does this mean and should I be worried?
Well, I would say if the person does not have enough vitality, even to raise a fever, so it means to say it is huge accumulation of toxins. Look at your food, lifestyle, and the stresses, and ensure you don't add more. And you will soon see an opportunity where body, raises the temperature, and the other toxins will be liquidated and thrown out of the body. I think others can add to whatever I've said.
Yeah, rightly said, Dr. Gauri. So, if your lifestyle is not correct, but still you have not raised a fever, that means, like what Dr. Gauri said, there is not enough vitality in the body. So, you will have to change your lifestyle and keep conserving your body's energy. And depending on how much is conserved, your body will raise a fever. And as Dr. Prashanthi said, when you raise a fever, celebrate it and ride through it without any medicines, with proper rest, and your health will become much better after the fever. So many rounds of such fevers are needed, especially if one has been in a chronic stage for a long time. So somebody asked, do you all give coaching for chronic cases also? Yes. So this session was about acute healing crisis, but chronic cases also, yes, all of us do give coaching. So there was a question by somebody about how to stop vomiting if a child develops one. And okay, Divyansh has already answered that vomiting is a sign of detox, so don't fight it. Body is trying to release something. And if they get dehydrated, just give water, coconut water or fruits. rest, and then the body will get better. Sri Kumar is saying keeping away from value added products keeps the doctor away. Okay, that's a good one. Do you all see any other questions which you think should be answered today?
Yeah, they have a lot of questions, but each question is a different topic for seminar, another seminar. We cannot cover it like that. So there are really good topic options. We could like do another uh, seminar like based on the comments.
So Neha Singh is asking when and where should we do wet pack? So I would say there is no need to do wet pack, especially during a fever or a healing crisis. So just leave it alone. The body has raised the temperature for a reason. So wet pack is not necessary in such conditions. But practically, when you look at the scenario at home, if there is pressure on you to take the child to the doctor because the temperature is very high, versus doing a wet pack and you being able to keep the child at home, then I would say do the wet pack rather than take the child to the doctor and get some intervention, chemical intervention done, which is really not recommended. Do something as simple as a wet pack just to keep the peace at home, so the temperature should come down. But all said and done, the temperature will rise again until the body has deemed that it has finished the job.
Yeah, but
Yes, sir.
don't do wet packs. I have seen people dripping their children in water with every fever, and then that will result in more issues. Don't do wet packs until unless it's necessary. Like, if there is a vomiting or something like that, and if they're having gastric issues, then you can do a little bit of wet pack just for to soothe them a bit, so that they're not going to keep on crying. And like as Asha was saying, maybe wet pack for the forehead little bit with the high fever, but I don't encourage any kind of wet packs as for fevers. It's not a good idea to do wet packs for fevers. It will increase. It will prolong the course of it.
Yes, even when the temperature is high, as Dr. Prashanthi said, the temperature will not be high for a long time. It will spike and it will come down also. So there is no need to panic. And most of the time, the problem happens when any kind of medicines are given, and whatever the body is managing and healing, if that is interfered with any kind of external intervention, that's when problems start happening. So somebody was asking about warts. Yes, that is also a form of elimination of the body. So last question we will take. Anyone can answer. Nandini is asking how to address body pain that comes with fevers. Kids may cry a lot with that pain. So
You may,
Divyansh, you want to take it as
I
a
didn't.
for dad of a young child? Can you answer this? How to address body pain that comes along with the fever, as kids may cry a lot with the pain?
Asha, did you just ask me?
Yes, so
Okay.
Nandini is asking how to address body pain that
And
comes
that comes
along with
with the
the
fever.
fever. Kids may cry a lot.
So every fever doesn't come with a body pain. Body pain is another sign, be it for kids or be it for adults, be it arthritis or be it back pains. Apart from the bones and the joints pain, if it is at the tissue level, it has to do with toxic accumulation. And when the body is trying to detox, push out the toxins through the lymphatic system, the neurological system takes a lot of load. So there are neurological pains, there is muscle pains, there is pains because a lot of muscles has to work around it. So uh, deep massages are not definitely not suggested for anybody, especially for not kids. Light strokes with light finger, like you do a soothing strokes, that can be done. But other than that, the from the childhood, the child has to know what the true detox is. What is a benchmark for my threshold to sustain a pain? They have to grow up with that. If not, then they will get a false idea of how much is high pain and how much is more pain, so but trust me, it's okay, the pain will go away. uh, all they need is a lot of care, love, caress, positive environment, play good music, expose them to sunlight, give them a bath. Water does help if, depending on which part of the body the pain is there. Water does help. So small things, rest will help. So the pain will go. Remember, there is going to be a sunrise next day, there's going to be a new day next day. So that's all I can
Yeah.
say. And I just want to conclude with saying, all of you are asking for different things. What about vomiting? What about diarrhea? What about cough? What about warts? In nature cure, we follow the foundation of nature cure is unity. The principle of unity, the law of unity says that the reason for all diseases is one. All diseases are one. The cure for all diseases is one. Okay, so when you do coaching with all these great coaches here, like Prashanthi and Asha and Swati ji and Gauri, you will learn in detail. This is not something we can cover in one webinar. So when you do the detailed coaching with them, you will understand that how all these foundations will help you, and thereafter you'll be like me, sitting here and giving a talk where you will not fear any disease and you will understand everything by yourself. So just spend more time, have some patience. I hope you're able to take back something from this webinar on fever specifically, and the germs and the terrain, and thereafter give it more time, sleep over this, and over the days you will understand more on these. Thank you.
Yeah, and I would also like to say both Dr. Prashanthi, myself, and Dr. Gauri, we conduct also educational courses on nature cure. So if you don't have time to read books, and you're confused about conflicting information, you want authentic information, you can join one of our courses. We will post all the information in the group that you all have joined. And yes, I hope we will keep doing more of these webinars because, life has to be enjoyed and lived to the fullest. Living in fear like this with so many confusions is not the way. So, thank you all for joining today's session, and thank you all to the presenters and Nandini for hosting this webinar. So, yes. I don't think we have time to do the quiz and summary, but next time, definitely. Have a great
Yeah.
Sunday, everyone. Take care. Bye.
Yeah. Good night.
Bye.
Bye.
Bye.